Over 200,000 NHS appointments may be cancelled this week. How did we get here? Tomorrow, doctors across England will walk out in what's being called the longest strike in NHS history. Over 200,000 appointments are expected to be cancelled, and while the headlines focus on disruption, I want to talk about the deeper fracture, one that Labour promised to heal. When the Conservative government left office, Labour stepped in with bold claims that they understood the NHS better, that they had a plan. But here we are, resident doctors still underpaid, inflation still biting, and the promises still unfulfilled. I once worked in healthcare. I supported the strikes, not because I wanted chaos, but because I saw colleagues stretched thin, their pay eroded by inflation while rent rose year after year. The government takes our taxes, yet somehow there is always more money for foreign wars than for the people who keep this country running. Yes, Labour raised the minimum wage, but they also raised taxes and they suspended the winter fuel payment for many pensioners. So, what does that wage increase mean when your salary disappears into rent, bills, and overpriced food? There is nothing left to save, nothing left to breathe. It's not always just about doctors, it's about dignity. It's about a government that promised to fix the NHS but hasn't even tried to fix the salary structures that keep it alive. So today I'm asking, is this strike a symptom or a scream? And what happens when the healers themselves are forced to fight for survival? Welcome to the podcast, What About Me? I am your host, Linda, and t- today I'll be exploring the NHS and the strikes that are being planned for this month in July 2025. Although we've heard that they are in discussion, the government and the NHS doctors are in discussion. So, are promises made, pay withheld, the roots of the NHS strike? Let's rewind. The British Medical Association says doctors' pay has eroded by nearly 26% in real terms since 2008. That's not just a number, it's a slow bleed, a quiet devaluation of the very people we trust with our lives. Last year, Labour swept into power promising to fix the NHS. They spoke of dignity, of understanding the system from the inside. But here is the truth: they have failed to even try to fix the salary structures that underpin it. The 5.4% uplift offered this year, it's a gesture, not a solution, especially when inflation continues to outpace wages and the cost of living turns every paycheck into a survival kit. I was working in the healthcare last year. I saw the strain. I supported the strikes, not out of defiance, but out of necessity. Because when rent rises every year, when winter fuel payments are suspended, and when taxes climb while wages stagnate, working people become economic hostages. We are taxed to fund foreign wars, while the very hands that heal are left empty. Labour may have increased the minimum wage, but what good is that when your salary vanishes into rent, bills, and overpriced food? There is no margin for saving, no room for breathing, and certainly no reward for the years of training, sacrifice, and service that doctors endure. This is about principle, about a government that promised transformation but delivered austerity in a new suit, and about a profession that's tired of being told to wait while the system collapses around them. So when doctors walk out, or if they choose to walk out of their offices, it won't be a tantrum, it will be a reckoning. But always remember there are echoes of discontent. The NHS has been here before. This isn't the first time the NHS has faced a reckoning. In fact, the roots of industrial action stretch back decades. In 1975, junior doctors walked out for the first time in NHS history, protesting a contract that slashed overtime pay. They worked strictly to rule emergency care only, and forced the government to revise its funding model. Then came the winter of discontent in 1976. NHS auxiliary staff, cleaners, porters, caterers were earning less than unskilled manual workers. Inflation was rising and goodwill was wearing thin. One cleaner told The Guardian she had just £5 a month left after bills to clothe her children. That strike reduced half of Britain's hospitals to emergency only services. Fast forward to 2016 when junior doctors again took action over a proposed contract that reclassified evening and weekend hours as social time. The BMA balloted 37,700 members, 98% voted to strike. And now, in 2025, we are here again. Resident doctors, formerly junior doctors, have taken industrial action 11 times since 2022. They are demanding a 29.2% pay uplift to reverse a real term pay erosion of 25 to 26% since 2008. Each strike has carried a message: we are not expendable. But what's different now is the scale. Over 1.5 million appointments have already been postponed due to previous strikes, and the public mood is shifting from sympathy to fatigue. Still, history reminds us strikes in the NHS are never taken lightly. They are not about greed, they are about survival, about a profession that's been undervalued for far too long, and a government that keeps asking for more while giving less. So when we talk about tomorrow's workouts, we are not just talking about disruption. We are talking about legacy, about a system that's been crying out for reform for nearly half a century. I remember standing in a hospital corridor last year watching a colleague finish a 12-hour shift with barely enough energy to speak. She was a resident doctor, brilliant, compassionate, exhausted. And like many of us, she was working through inflation, raising rent, and a government that kept saying, we are listening while doing nothing. I supported the strikes, not because I wanted disruption, but because I saw the slow erosion of dignity. The Labour Party, which now governs, claims to understand the NHS better than the Conservatives. They promised reform, they promised fairness, but when it came to pay restoration, they offered silence. And here is the uncomfortable truth: Labour controls many of the unions that claim to stand for workers. During Conservative rule, those unions were loud, mobilizing marches, demanding justice. But now, under Labour, they have grown quiet. Their bosses sit in government offices while the workers they represent are left to fend for themselves. One doctor said, we got a 5.4% uplift this year, but my rent went up 7%. My food bills rose 12%, and the winter fuel payment was suspended. What exactly am I supposed to celebrate? Another nurse shared, I used to believe the union was my shield. Now it feels like a gatekeeper protecting the party, not the people. And I've felt it too: the squeeze, the frustration, the sense that we are being taxed to fund foreign wars while our own hospitals crumble, that we are praised as heroes but paid like afterthoughts. This isn't just a policy failure, it's a moral one. When the party that claims to champion workers becomes complicit in their silence, the betrayal cuts deeper. So when the doctors choose to walk out this year, it's not just about pay, it's about principle, about reclaiming a voice that's been muted by political convenience, and about reminding the government, Labour or otherwise, that healing begins with justice. So here is the public perception and political narrative. Silenced unions, shifting sympathy, who really stand with the workers. The media headlines are clear: NHS summer chaos, strike threatens recovery, doctors risk breaking the system. But beneath the noise lies a deeper question: who do we trust to fix the NHS? When the Labour government was campaigning last year, they promised to end public sector strikes. They even brokered a deal last September, a 22.3% uplift over 2 years, followed by a 5.4% rise this year. But now, just months later, doctors are walking out again. Why? Because even with those increases, their pay remains 20% lower in real terms than in 2008. Health Secretary Wes Streeting calls the strikes completely unreasonable. He says the NHS recovery is hanging by a thread and accuses the BMA of threatening it. But here is the contradiction. The same unions that were loud under the Conservatives are now subdued under Labour. Why? Because their leadership is politically aligned with the government of Labour. And when your boss sits in cabinet, your voice gets filtered. The British Medical Association insists it tried to negotiate. They met with the health secretary. They asked for a credible path to pay restoration, but the government refused to discuss pay. Instead, they offered vague promises about non-pay elements without saying what those are. And the public, they are divided. A recent YouGov poll shows 48% oppose the strike, while 39% support it. That's a shift from last summer, when 52% backed junior doctors. Sympathy is waning, not because the cause is unjust, but because the messaging is muddled. Labour's credibility is on the line. They promise transformation, but when the unions they control fall silent and the workers they represent are forced to strike, the illusion of solidarity shatters. This is a perception crisis, and in politics, perception is power. But there is always something happening where we don't see. Unite, the union, Labour's largest financial backer, has suspended Deputy Prime Minister Angela Rayner's membership over her handling of the Birmingham Dean strikes. The union accuses Rayner of backing a Labour-run council that used fire and rehire tactics, threatening bin workers with redundancy unless they accepted pay cuts of up to £8,000. Unite's General Secretary Sharon Graham didn't mince words. I quote, Angela Rayner backed a Rouge council that peddled lies and smeared its workers. This is fire and rehire under a Labour government. It makes a joke of their promises to working people. The union has now voted to review its relationship with the Labour Party, a move that could trigger a formal split and a funding crisis for Starmer's government. Let's be clear, this isn't just a union dispute. It's a crisis of credibility. Labour promised a new deal for working people, but when the party's own deputy prime minister is accused of siding with a council that slashes wages and silences dissent, the betrayal cuts deep. And it echoes what we've seen in the NHS. Labour controls the unions. They encourage strikes under the Conservatives. But now in power, they have grown quiet, leaving workers to fight alone. So I ask again, whose side is Labour government really on? Because if the party of workers is now complicit in attacking them, then maybe it's not the workers who have changed, but the party itself. This isn't just a political fallout, it's a warning that solidarity must be earned, not assumed, and that workers will not be silenced, even when their supposed allies are the ones holding the megaphone. Let me ask a question. Can doctors strike without betraying their calling? There is a moral tension at the heart of this strike. Doctors are healers. Their absence can delay diagnosis, postpone surgeries, and disrupt care. So how do we reconcile that with the ethics of protest? Some argue that striking in healthcare is inherently wrong, that it risks harm to patients and betrays the Hippocratic oath. But biblical ethics offer a more nuanced lens. In Micah 6:8, we are told, what does the Lord require of you? To act justly, to love mercy, and to walk humbly with your God. Justice and mercy are not opposite, they are intertwined. And sometimes mercy means refusing to work under unjust conditions that compromise care in the long run. The Bible also teaches that every person is made in the image of God, worthy of dignity, not exploitation. When doctors are underpaid, overworked, and ignored, their ability to care is diminished. That's not just a workforce issue, it's a spiritual one. Atheists argue that harm in strike action must be proportional and justified. A missed outpatient appointment is not the same as a missed cancer diagnosis. And if the strike leads to systemic reform, better staffing, safer rotas, restored pay, then the short term disruption may be morally defensible. But here is the deeper irony. Labor claims to champion justice. They control unions that once roared against injustice. Yet now, those unions are quiet. Their bosses sit in government, while the workers they represent are left to fight alone. So I ask, is it more ethical to stay silent in the face of injustice or to disrupt in pursuit of healing? Jesus healed the sick, yes, but he also overturned tables in the temple. He challenged systems that exploited the vulnerable, and he did so not out of rage, but out of righteousness. Therefore, this strike is a cry for restoration. Here are my final thoughts on the doctors' strikes or proposed doctors' strikes, or hopefully they find a better deal on the table with the government. When promises fade, voices must rise. The strike isn't just a disruption, it's a declaration that dignity matters, that promises must be kept, and that healing begins with justice. Labour said they understood the NHS. They said they would fix it. But when the unions they control fall silent and the workers they represent are forced to strike, the illusion of solidarity crumbles. So what can we do? Write to your MP, share this episode, support the doctors not just in their protest, because when those who heal are forced to fight, it's not just a system that's broken, it's a covenant. And when pressure warps the profession, behind the picket lines and the policy debates lies a quieter crisis, one that rarely makes headlines. The mental health of doctors in the UK is deteriorating under the weight of economic pressure, and it's reshaping not just their well being, but their professional identity. The British Medical Association reports that 26% of doctors have considered leaving the profession due to stress, burnout, and financial strain, and it's no wonder. Living costs have soared, rent rises annually, food prices remain inflated, and despite a 5.4% pay uplift this year, many doctors say their salaries still fall short of survival, let alone stability. One resident doctor shared anonymously, I've started cutting corners, not in care, but in how I present myself. I smile when I am exhausted. I reassure patients when I'm unsure. I pretend I'm copying because admitting I'm not feels like failure. This is what pressure does. It forces misrepresentation, not one of deceit, but out of desperation. Doctors are trained to heal, not to hustle. Yet today, many feel they must perform resilience to protect their reputation, their career, and their patients. And the system reinforces it. Mental health services are underfunded. The NHS budget for mental health in 2025-2026 is £15.6 billion, but that's just 8.7% of total NHS funding, despite mental illnesses accounting for over 20% of the disease burden. Demand in rising, but support is not. So doctors internalize the strain. They suppress their own needs to meet others, and in doing so, they risk becoming caricatures of their calling, silent, stretched. This is unjust and unsustainable because when the healers are forced to misrepresent their own well being, the profession itself begins to fracture. We must ask, what kind of system demands silence from those who speak life? And what kind of government calls for compassion while ignoring the cost of living that erodes it? Mental health isn't a luxury, It's a foundation. And if we want doctors to care for us, we must first care for them through the system. Thank you for listening today. Bye.